Morning everyone. Today's our topic is deep muscles of back. So these muscles of back are arranged in four layers, superficial to deep. Four layers are there. So starting with the from head to bottom, from the back of neck and then entire back. So first of all, some anatomical landmarks you have to remember. That is this diagram showing the norma occipitalis, or we can say posterior view of skull. Showing the this one is the occipital bone. Within the occipital bone there is a highest area is that is called the external occipital protuberance, the median aspect. This one is the external occipital crest, and from the external occipital protuberance there are two curved bony ridges that is called as a superior nuchal line. And above the superior nuchal line there is a highest nuchal line, and below there is a inferior nuchal line. And below there is spine of the cervical vertebra are there. Posterior tubercle of atlas, spine of C2 and spine of C7. So this region is called the suboccipital region. So this portion lies within the back of neck. So starting with the back of neck, soft tissue on the back of neck are divided into four layers from superficial to deep. These are the skin, then superficial fascia, then deep fascia, and then muscles. The skin of the back of the neck is supplied by medial branches of dorsal rami of C2, C3, C4. Because C1 has no any cutaneous or medial or lateral branches. That's why it is supplied by C2, C3 and C4. And rest of the part of the back are supplied by the branches of the dorsal rami of the thoracic, lumbar, sacral, spinal nerves. So these cutaneous nerves which supply the skin, these are the greater occipital nerve C2, third occipital nerve C3, and cutaneous branches of C4 and C5. In short, these medial branches of dorsal rami of C2, C3, C4 supply the skin of the back of neck. Then superficial fascia, it is thick and very tough. It contains the cutaneous nerves and vessels. Then deep fascia. Here the deep fascia of the back is called the nuchal fascia. It is attached in the medial plane to the spine of the vertebrae, supraspinous ligaments, and in case of neck region, ligamentum nuchae. And externally, it extends laterally and it seats the muscles of the back. Now we discuss about the ligamentum nuchae. It is what? So it is a triangular sheet of fibroelastic tissue that forms the median fibrous septum between the muscles of the two sides of the back of neck. So ligamentum nuchae presents three borders. First is the superior border. It is attached to the external occipital crest. Then this one is the anterior border. Anterior border is attached to the posterior tubercle of atlas and spine of C2 to C7. And three posterior border which extend from external occipital protuberance up to the tip of spine of cervical vertebra 7. Then there is a location of the deep muscles of the back. Now muscles of the entire back can be grouped into the four layers from superficial to deeper plane. First layer containing the from above, that is the trapezius muscle, and from below, that is the latissimus dorsi. Both the muscle you already learn in case of upper limb. So we just go through superficial aspect. Trapezius muscle is arise from here, and its fiber passes downward and laterally and inserted over the scapula. So half right side and left side, half portion of the trapezium from the half prismoid shape. So entire trapezius, right and left trapezius form the diamond shape structure. So that is the trapezius muscle. So trapezius muscle cover the upper half of the back. So that is the first layer of the muscle of the back. And from the lower half of the back, superficially, that is covered by the latissimus dorsi. Latissimus dorsi arises from this portion, from the iliac crest and spine of the lumbar and thoracic vertebra, and its fiber passes upward and laterally and finally inserted into the floor of the bicipital. So superficial layer of the muscles of the back are the trapezius and latissimus dorsi. Trapezius muscle is supplied by the spinal accessory nerve, that is 11th cranial nerve, and some proprioceptive fibers supplied by the C3, 4 and C3 and C4 cervical spinal nerve. Latissimus dorsi that is supplied by the branch of the brachial plexus, that is now to latissimus dorsi, branch of the posterior cord of brachial plexus. Trapezius muscle having action along with the levator scapulae, that is shrugging of shoulder or elevation of shoulder, along with the other deep muscle, that is rhomboidus muscle. It steady the scapula as well as retraction of the scapula. While latissimus dorsi having action is the flexion, medial rotation, adduction. So this muscle helpful in the swimming action or climbing action. So this is the first layer of muscle. Deep to this, there is a second layer of entire back, starting from neck to bottom. It contains the levator scapulae and rhomboidus muscle. Particularly in the neck region, these three muscles are there. Just below the trapezius muscle, levator scapulae, this is the origin of the levator scapulae, and insertion on the scapula, that is the medial border of scapula from superior angle to root of the spine. So this is the insertion in posterior tubercle or transverse posterior upper four cervical vertebra, that is the origin of the levator scapulae. These muscles you already learned in case of upper leg. The levator scapulae, then rhomboidus minor and major. They are inserted here, minor and major. Origin here. So this muscle lies in the second layer. Other muscles on the rest of the part of the back, that is serratus posterior, superior and inferior. So serratus posterior superior muscle arise from the spine of C7 as well as T1 and T2 spine of the vertebra, and it is inserted into 2 to 5 ribs. Then serratus posterior inferior muscles that arise from the T11 and T12 spine as well as thoracolumbar fascia, and it is inserted into 9 to 12 ribs. So that lies on the lower part. And then second layer contains the important muscle, that is the splenius muscle. So splenius muscle is divided into three divisions: splenius thoracis, splenius cervicis, and splenius capitis. So we discussed the two divisions: splenius capitis and splenius cervicis. So these are the origin. Origin is below and insertion above. So splenius muscle arise from the lower portion of the ligamentum nuchae, spine of C7, and spine of the upper four thoracic vertebra. That is the actual origin of this splenius capitis. But in short, spine of C7 to T6 vertebra, that is the origin of this splenius muscle itself. Then it muscle divided into two parts: splenius cervicis and splenius capitis. So splenius cervicis is inserted into the posterior tubercular transverse process of upper four cervical vertebrae, and splenius capitis passes upward and laterally, passes just under cover of the trapezius muscle and from the floor, one of the floor, muscular floor of the posterior triangle of neck. Then finally it is inserted into the mastoid process under cover of the sternocleidomastoid muscle as well as on the lateral one third of the superior nuchal line. So this is the insertion of this splenius capitis muscle. So after trapezius, this ligament, levator scapulae, rhomboidal muscle, they are present here, here to here, and another muscle can be seen in the second layer, that is the splenius capitis muscle. So this splenius muscle supplied by the medial branches of the dorsal and the cervical spinal nerve. Then come to the third layer. So this diagram also showing the splenius capitis muscle, and this one is the splenius cervicis. These are the two divisions of the splenius muscle. This one is the cut portion of the levator scapulae can be seen. This diagram showing the Splenius Capitis and Splenius cervicis. Now, what is the meaning of Splenius? Splenius means bandage like, so it covers the deep muscle like a bandage. Now, these are the Levator Scapulae, rhomboides minor, rhomboides major. Now, come to the third layer of muscle of the back, that is this muscle, that is erector spinae or sacrospinalis muscle. This one is the thoracolumbar fascia, provides attachment to the serratus posterior. Now, third layer muscle, including two muscles, erector spinae or sacrospinalis and semi-spinalis muscle. Erector spinae or sacrospinalis, it, it is present on the, it is a true muscle of the back, supplied by the posterior rami of the spinal nerves and extend from sacrum up to the skull. So origin from the back of sacrum between the median and lateral sacral crest. So this U-shaped area provides origin of the erector spinae muscle. Origin. And also arise from the dorsal segment of the iliac crest and related ligaments. These are the origin of the erector spinae or sacrospinalis. Then it passes upwards, so within the lumbar region, it extends and then it subdivides into three vertical columns from lateral to medial. It is called as a iliocostalis, longissimus, and spinalis. So spinalis lies in the most medial aspect, that is attached or inserted into the spine of the vertebra. Then intermediate or middle layer contains the longissimus muscle that is inserted into the transverse processes, and most laterally that is iliocostalis muscle that is inserted into the ribs. Okay, so it is subdivided into three vertical columns: medial to lateral, spinalis, longissimus, iliocostalis. Now, iliocostalis muscle again divided into three subdivision according to their location. Iliocostalis lumborum in the lumbar region, iliocostalis thoracis, and iliocostalis cervicis. Iliocostalis lumborum, thoracis, and cervicis having small slip. So these are the short slips and inserted into the angle of the ribs. They are inserted into the angle of the ribs. The angle of the ribs lies on the posterior aspect where they are inserted. And posterior tubercle of the cervical transverse process. An origin of the fresher slip or higher slip that lies medial to the insertion of the lower slips. So that is the origin insertion of the iliocostalis, lumborum, thoracis, and cervicis from below upwards. So that lies on the most lateral aspect. In short, they are inserted into the ribs, angle of the ribs. Then intermediate column that contain the longissimus muscle. So longissimus muscle is lies in the middle column and it's composed of the longissimus thoracis, cervicis, and capitis. Longissimus thoracis inserted in the transverse process of the thoracic vertebra. Longissimus cervicis muscle inserted into the transverse process of the C2 to C6 vertebra, while longissimus capitis inserted into the, this one is the longissimus capitis. It is inserted into the mastoid process, deep to the splenius capitis and sternocleidomastoid. This one is the longissimus capitis can be seen. It arises from the posterior tubercular transverse process of the lower four cervical vertebrae, C4, 5, 6, and 7. Then all the slips merge and form the longissimus capitis, and finally inserted in the mastoid process deep to the splenius capitis. And spinalis column lies in the medial aspect that contains the same spinalis lumborum, thoracis, and cervicis. They extend between the lumbar and cervical spine. That lies on the medial aspect. So this diagram showing the spinalis thoracis. Spinalis cervicis can be seen here. Spinalis lumborum. Now, other muscle of the third layer group, that is the semi-spinalis. Semi-spinal is again divided into semi-spinal is thoracis, semi-spinal is cervicis, and capitis. So semi-spinal is muscle extend between the transverse processes and spine of the vertebra. So it has three parts. So this semi-spinal muscle lies in the upper half of the vertebral column from thorax to capitis. Semi-spinal capitis is the biggest component that can be seen in this diagram. So origin of the semi-spinal capitis is arise from the transverse process of the lower four cervical vertebra and upper six thoracic vertebra. And fiber passes upward along with the medial plane, and they are inserted into the medial part of the area between the superior and inferior nuchal lines. Provides insertion of semi-spinalis capitis. So that lies in along with the erector spinae muscle, but in the upper part of the vertebral column, upper part of the back of vertebral column. So semi-spinalis capitis, and then semi-spinalis cervicis muscle. It lies deep to the lower fiber of the semi-spinalis capitis and arises from the transverse process of the lower cervical and upper thoracic vertebra, means C5 to T4, and inserted into the spine of the cervical vertebra C2 to C4. So both the muscles supplied by the medial branches of the dorsal lemma of the spinal nerves. So these are the third layer muscles: semi-spinalis, capitis, cervicis, and thoracis. Now fourth layer muscle, that is the deeper group: multifidus, rotators, interspinalis, intertransversi, and lastly the deepest muscle, that is the suboccipital muscle. First of all, the multifidus muscle. This oblique deep muscle arises from the mammillary process of the lumbar vertebra and to be inserted into the 2 to 3 higher spine of the vertebra. So that lies in the lumbar region, multifidus. Then rotators, deepest group of muscle. They pass from root of transverse process to the root of the spinous process. They are well developed in case of thoracic region. So these muscle diagrams in the rotator thoracis having a short and long slit, right? So rotator muscle is well developed in case of thoracic region. Then interspinalis. Interspinalis means between the spine of the vertebra. It lies between the adjacent spine of the vertebra, that is called the interspinalis, and it is well developed in case of cervical region as well as lumbar region. Then intertransversi, between the transverse process of the adjacent vertebrae. And lastly, the suboccipital muscle. They are the deepest group, and they are present within the suboccipital region on each side from the suboccipital triangle, right? So the suboccipital muscle you will learn in case of suboccipital region. Okay, so these are the muscles of the back, deep muscles of the back, attached in the superficial to deeper plane. The superficial plane, they are trapezius and latissimus dorsi. In case of second layer, that is the arrangement, that is Levator Scapulae, rhomboides minor major, Serratus posterior, superior and inferior. Then Splenius capitis and cervicis muscle. Then third layer containing the erector spinae muscle, and also semi-spinalis muscle. Semi-spinalis again divided into semi-spinalis, thoracis, cervicis, and capitis. And lastly, the fourth layer containing the multifidus muscle, then rotators, intertransversi, interspinalis, and lastly the suboccipital muscle. Okay, I think you learn very well. Thank you.